Self-injurious behavior can be a common occurrence exhibited by children with autism spectrum and other disorders. It can be a frightening experience for caregivers and professionals. To determine interventions or ways to decrease this behavior, it is imperative that the function or reason for the behavior can be determined. Begin by completing an ABC chart. Note when and where the behavior occurred, who was present, what may have happened right before. Describe the type of self-injurious behavior. Note what happened after the behavior occurred. The last column is called possible hypotheses. That has to do with the functions or the reasons. Does the child want to gain access to something? Is he or she frustrated or in pain? Perhaps trying to escape an activity or a person, or gaining sensory input, or seeking peer or adult attention. Remember, sometimes a behavior may start for one reason but turn into another. A child may seek sensory input, but when adults or peers react, it may turn into an attention-seeking behavior. Once you're confident in a reason, begin to decide on an intervention. If it's communication, find a tool for the child to communicate. If the behavior occurs in school when academic demands are in place, create a schedule that includes reinforcers and consider decreasing the demands. If at home, provide a rich schedule of engagement activities. When a child is engaged, he is less likely to display behaviors of concern. If the reason is sensory, try to provide replacement tools. For example, if the child bites himself, provide a topper on pencils or straws, gum, or pieces of candy as licorice or gummy bears. Be sure to offer the edibles before a behavior and not during or immediately after. Remember, prevention is the key. If the child is in danger, interrupt with as little attention in your voice and facial expressions. It is also possible these behaviors may have a biological base. Always check with your doctor and service providers to rule out other functions. If the self-injurious behaviors are at a high rate or intensity, or they continue despite programming changes, work with a behavior specialist to continue assessment and interventions. For further information, visit thewatsoninstitute.org.